Hello, I'm Paul Throne, State WIC Director for Washington and Chair of the National WIC Association Board of Directors. I'm speaking to you today from Spokane, Washington, which is on the traditional lands of the Spokane peoples. It's a pleasure to welcome you to this live armchair conversation. The WIC program is vast. From the U.S. Virgin Islands to Guam is nearly 9,500 miles. That's farther than from Anchorage, Alaska to Antarctica. So good morning, good evening, good afternoon, wherever you're tuning into today across the wide world of WIC. We're glad to have you with us. I want to begin today by acknowledging that once again, we have been reminded in a horrible way of how broken some of our systems are. Another young Black man died at the hands of law enforcement officers who were sworn to protect and serve. Tyree Nichols was 29 years old, and he leaves a 4-year-old son, as well as his mother, Rovon Wells, and his stepfather, Rodney Wells. Tyree was a photographer. He loved skateboarding, and he had recently moved to Memphis, where he used his art to celebrate Beale Street. Tyree's death reminds us that the work to create a more just world remains unfinished. But I am also hopeful. We have to believe that the better nature in people will prevail. There are so many more people who see the best in others and who put their time and effort into making this nation a place where we can each feel safe, nurtured, and respected. And WIC is part of that effort. I'm proud to be part of an organization that finds ways to ease the burdens of caring for young children, supports healthy pregnancy, infancy, and childhood, and plays an important part in reducing the toxic stress that so many families have to manage every day. The National WIC Association is the nonprofit education arm and advocacy voice of the Special Supplemental Nutrition Program for Women, Infants, and Children called WIC. Our vision is a nation of healthier women, children, and their families. And we provide our members with tools and leadership to expand and sustain effective nutrition services for mothers and young children. We recently experienced one of the biggest advances in our organization in decades, selecting and hiring our new president and CEO. It is my pleasure to introduce Dr. Jamila Taylor.
Hi, Paul. Good afternoon and good morning, good evening to everyone joining us on this live stream. I'm Dr. Jamila Taylor, the new president and CEO of the National WIC Association. And I guess I should just get started and talk about myself. Sorry, folks. I was a little confused on how we were sort of managing this opening part of the conversation. But let me just start off by, first of all, I want to thank you, Paul, for, the solemn words that you shared in your introduction related to Tyree Nichols and his untimely, senseless death. As a mother, and a Black woman in this country, I can't begin to express how disheartening it is each and every time we have to experience, these senseless tragedies. And so my heart is with anyone, listening or participating today who may be grieving or maybe struggling to understand why this keeps happening. And at the same time, I am hopeful, just like Paul, that as a community working in social justice, that we can move ahead and call finally for the reforms that we need to address this issue for all. And so with that, I think, that also brings me to, really the work that, or my vision for, how I want to enter into this space with WIC. For me and Paul, it was important to set the stage this afternoon and talk about the death of Tyree and also link it to the work that we do at the National WIC Association. We are an organization that supports moms and families, and we meet them where they are with quality nutrition supports, as well as linkages to critical healthcare services, and also really supporting families on the front lines. I can't begin to tell you, in the 2 months or so that I've been in this job, I've had the chance to travel across the country and hear from not only our colleagues working in WIC on the front lines, but also moms who are participating in the program. And each and every mom that I have spoken to has not only talked about the needs of herself and her family when it comes to nutrition access, but also issues like housing insecurity, having access to quality healthcare services, childcare supports, pay equity, and a whole host of other issues. So for me, that's why it's going to be so important, I think, in this next stage and next chapter of the National WIC Association, that we really lean into a more intersectional approach in how we do the work as part of the organization. And so with that, we have a lot of cool things that we're going to get into today in terms of the conversation. We're going to talk about the National Policy Conference that's coming up in a few weeks that the organization is planning. We have some exciting updates there. We're going to talk about the food package rule, something that, the WIC community has been anticipating for a while now. The last update to the food package was in 2009. So this is huge for the community. And then we're also going to talk about the State of WIC report and a whole host of other fun topics. And so I'll pass things back over to you, Paul.
Thank you so much, Dr. Taylor. It's great to have this time to talk with you today because, as you mentioned, you're about 2.5 months on the job now. I would love to know, what are your first impressions of WIC from this perspective? I know you're familiar with WIC from your work in the maternal and child health space for a long time, but now that you're right at the center of WIC, what have your impressions been, and what have you heard from the people you've been talking to?
Yeah, I think one of the things that sticks out to me the most is just the passion and dedication of WIC staff. So many of the people that I've been able to speak with, since I've come on board, whether it's our members, our extremely talented members, or other folks in the field and on the ground, is that, these folks have been working in WIC for decades. It's hard not to find someone that has served at least 20 years, when it comes to WIC. And, there's so much passion and support that lies within them when it comes to supporting these families. And so to me, that is something that stands out, in my 2+ decades career in working as a professional. I've never seen that type of dedication and support before. And so that has been really humbling for me. And then I think also too, another side of that is getting to talk to participants in the program and, hearing from them directly about, the support that they get when they walk into WIC clinics and they speak to the folks doing intake there, and how welcomed they are, how they feel valued as they interface with WIC staff. They also talk about the supports that they're getting and how that's helped to change, the whole, sort of situation at home, whether it's helping them, mentally, as a mom. I remember myself, feeling, stress, when I first brought my baby home and trying to figure out, how to breastfeed, and having that support, having a lactation consultant was really important for me. And I've also heard from WIC moms, how important it is for them. And so lactation supports that, WIC facilities are providing with families has also been something, a real theme that I've seen from moms as well. And then also, I think, this is a good moment to mention too, that the staff at NWA has been completely amazing. And another, again, hardworking folks that are so dedicated to the WIC program and ensuring that our members and participants across the country, are able to elevate and advocate on behalf of this amazing program. And, it's just a really exciting time. So I can't stress enough how blessed I am to be a part of this community and how welcoming everyone has been.
Thank you, Dr. Taylor. One of the things you mentioned that is really important for all of us to be thinking about right now is the food package rule that has been proposed. And as you mentioned, USDA, for the first time since 2009, has proposed changes, and these are really significant changes. It would make our fruit and vegetable bump permanent after almost 2 years now. It's sort of start and stop changing of the fruit and vegetable benefit. It would be a permanent increase, which would be amazing. It would reduce juices and allow additional fruits and vegetables instead. It would increase the number of WIC participants who are eligible for seafood and its nutritional benefits from about 3.5% of our participants to almost 60%. And it accommodates allergies, vegan diets, cultural preferences, and boosts whole grains. The last time, the last time these kinds of changes were made, it had an incredible impact on childhood obesity among toddlers in the WIC program. 9% decrease in childhood obesity, which is, as we know, it has like a lifelong impact.
Mhm.
How do you see the food change rules' potential impact upon our program, and what do you want the members to know about these rules?
Yeah, well, I definitely see, the changes are so important, as you mentioned, Paul, there were so many, this is an evidence-based program and, WIC continues to follow the evidence. And so it's really an important moment to, think about, how we're just elevating and ensuring that, families can get optimal nutrition from the supports under the WIC program. And so I think a part of not only the food package and what's going to be included in that package is also going to be important, that our families are also getting the education that they need to understand, why these foods are nutritious and, nutrient rich and, important for their families to be consuming. And so that's a key piece of it. One of the things that I've also said too is that it's important for, food to taste good. And so, another thing in the food package is, there are some expansions and, being able to use those vouchers for, herbs and spices that will also support, ensuring that, those recipes are flavorful and that families enjoy them. And so I think that's all a part of the conversation and the focus. And I think another piece of this too is that, you know, a big part of, sort of where the community is going in terms of like innovation. Innovation is also how we're rethinking nutrition and how we're moving along, following the science when it comes to, adequate nutrition for families. And so to me, that also sort of fits within the umbrella of, innovation under the WIC program. And so I think it's important for families to know, what's included in the package, how it's different from the previous package, and then having the education and support to follow through, and making sure that families will have access to good recipes to make sure that their food is flavorful. And so with that, I do want to have a quick plug. The National WIC Association is also thinking about putting together a recipe book that will be accessible to all of our members, as well as WIC families. And so that will be something to help, families think and be creative about, how to use and leverage, all of the nutritious foods in their food package and make it yummy and, exciting for families to eat. And so one thing that I did not mention, I know we did have across the screen going there, is that, folks can submit comments to the food package rule. NWA actually has a template that is easy to use and access for folks. And you can find it at bit.ly/WIC food package. And it's available until February 21st. So, definitely go to that link and access the template. And then you can also add your own language or flavor, no pun intended there, to the comments as well, for you to submit to add your own, personal touch to it.
Dr. Taylor, you have a long experience in Washington, D.C., working on the Hill and working with Congress. What impact do you see it making upon USDA if we submit comments? Are they heard? Do they consider them?
I think they are heard, definitely. I mean, particularly at the agency level, these comments are going directly to USDA for them to consider as they move from, introducing or, releasing the proposed rule to, implementing that. And so it's definitely important for folks to weigh in. You will be heard. And I think in terms of the congressional scene, the conversation is going to be a little bit different there. From what I understand, there are some members of Congress that are also going to be, commenting on the rule as well. Folks that have been longtime champions of the WIC program and ensuring adequate nutrition for families. And so it'll be important for the agencies to also hear from members as well to show their support. At the same time, the advancements that we're seeing in the food package rule is also a part of a broader sort of, national policy agenda, that we have in the WIC space. And so this is a piece or one part of the one tool in the toolbox, so to say, when we think about the advancements that we want to make under the WIC program. And, Congress and the administration and the agencies all have a role to play in helping to advance this. I will tell you, though, that, things, on the Hill right now are kind of bottlenecked, and there's a lot of some challenges in seeing common ground right now. It's a moment of transition, new members. There was some delay in them getting sworn in. And so I think once they get their grounding, we'll start to see, more concerted effort into advancing some of the things that we care about. So I'm looking forward to that. I'm looking forward to Congress getting their grounding so we can move along and, focus on handling the business of, supports and the resources that families need in this country.
You've mentioned some champions for WIC on the Hill, and I think one of the things that's wonderful about this program is that it's always had such bipartisan support. Mm-hmm. It's really one of our strengths, and through good times and bad times in Washington, D.C., WIC has always been able to find a way forward, and I'm really hopeful that will continue to be the case. We're about to have a pretty big conference next month, and I think it'd be wonderful to talk a little bit about the National WIC Association National Policy Conference. What is this conference and what will be happening there?
Absolutely. I'm excited to talk about the conference. And so NWA is hosting a virtual National Policy Conference. It's going to be held from February 21st through 24th. Registration is still open. You can see the link to register on our screen there. And registration is going to be open until February 10th. So you still have some time to make sure you get that registration in soon. Again, you can see the link on the screen there. And so the National Policy Conference is really an opportunity for folks that want to participate to, witness and be a part of the conversation on the future of WIC. Paul and I have already talked about today, some of the advancements that we're trying to move forward in addition to the food package rule, but really thinking about how to innovate WIC, especially as we're going to be coming up on the 50th anniversary of the program next year. You're also going to hear from government leaders from USDA and congressional representatives. You're going to get to meet with members of Congress and talk about the importance of WIC to families across this country, and also gain leadership and advocacy skills. One of the things that NWA prides ourselves in is the education and advocacy support that we provide, not only to our members, but to those across the WIC community and in the advocacy community. And so folks that are going to be participating in the conference will also have the opportunity to gain some skills in terms of your advocacy and policy chops. And then you'll also learn about, have a deeper, sort of introduction or, fortification of your learning around WIC policy issues. And so those are some of the highlights. And then, Paul also mentioned that we're going to have some exciting speakers, a part of the conversation. And so just to share some of those, we're going to have Stacy Dean, who is a Deputy Undersecretary of USDA's Food, Nutrition, and Consumer Services. My former boss on Capitol Hill, Representative Bobby Scott, who represents Virginia's 3rd Congressional District and is also now the ranking member of the Committee on Education and the Workforce. Representative Jim McGovern of Massachusetts, 2nd Congressional District and the chair of the Congressional Hunger Caucus. And then we'll also have Senator Debbie Stabenow, Senator from Michigan. And so this is just a taste of, the amazing VIPs that we're going to have in the virtual room for the event. So, please join us and register. Again, the link is on your screen there.
I've always found this to be my favorite conference of the year, to be honest. NWA puts on amazing events, and they're all wonderful to attend. But for me as a state director, the policy conference has always been really the key for me. It's the chance to interact directly with my congressional delegation. And it's a wonderful time to get together with our WIC community and really realize what common ground we have, what our major priorities are, and to go to Capitol Hill with a really unified voice. And I've seen some amazing things happen over time when we are all together around an issue. For example, a number of years ago, we were able to get 50% increase in the funding allocated to the Breastfeeding Peer Counsel program because we all agreed that that was a priority for us. And so we were able to have that program fully funded. It's an incredible thing for all of our WIC programs to be together and to talk to each other and to decide what matters the most to us. And to have Congress right there in the future, I hope we'll be able to be back in person. To have Congress right there waiting to hear from us is a remarkable experience.
Yeah, and I'll also say too, as a former congressional staffer, I can tell you all that, members and their staff love nothing more than to hear from folks that represent them, that they are representing in Washington. And so, and they would rather hear from those folks instead of any lobbyists any day. And so it's really going to be a treat, not only for those of you that are participating in the conference and all that we have to offer you there, but also for you to be there and to be able to share your thoughts on policy issues around WIC, but also sharing your experience. If you're working in WIC on the ground, if you're a participant in the program, it'll be really important for members of Congress to hear your story. So also bring that along with you if you plan to go on these congressional visits.
Dr. Taylor, a lot of people are anxious about visiting with their congressional delegation, and they don't really know how to do that, or it's an intimidating thing. What advice would you offer to somebody who's never done it before?
Well, the first thing I would say is there's no need to be intimidated. They're people, humans just like you. And I think if you enter into the program or the conversation again in a way that you're entering into is sharing your story, starting with your experience with the WIC program. I think that's a great way to break the ice, actually, if you are, having some nerves about the conversation. You cannot go wrong, coming into those conversations and just sharing, what's in your heart, as well as your position on, these important issues. You are the expert on your own experience and story. So just remember that when you go into the conversations with members of Congress, and they are happy to see you. I know that being outside of the DC bubble per se, you sort of see, images of the Capitol on the news, or you see members of Congress talking about, various policy issues on the news. But don't let that, bewilder you. You're a part of the conversation. You're just as much a part of how decisions are made in this country. And so enter into those congressional visits with that in mind.
Thank you. I have to say, I've found it really opens doors to bring local agency staff with me or to bring WIC participants with me. Mm-hmm. Members of Congress and their staff love to talk to the people who actually benefit from the program. And it seems to make a huge impression. So in the future, when we're able to visit again, or even now when we're doing these visits virtually with our congressional delegation, having local agency staff who live in that member's district is really helpful. But having a WIC participant or two on the call who live in that district and can talk about the program, it really seems to attract their attention and get them really interested in what we're doing. So it's a wonderful opportunity again. I'm looking forward to this conference very much. Because it's virtual this year, I'm able to bring a lot more staff to it than I could if it was in person in DC. It's a great way to expose more people in the WIC world to what policy work is about and how important it is for supporting our program.
Yeah, absolutely. And I do hope that at some point we're going to be able to come back together and meet in person or host, the WIC community in person in Washington. I think there's something just so magical about being here in the city and walking those halls, that, is I miss, quite frankly. And so hopefully, others that have participated in the conference before are also feeling that. And so, but again, as Paul mentioned, there are also, some great things about being able to hold it virtually because we are able to have more participants. Folks may be living in places where, travel is hard to do in this moment, and also want to recognize the fact that, we are seeing, rates of COVID-19 go up in some areas, in addition to a whole host of other communicable diseases in this moment. And so recognize that the right thing, was to have the conference virtually this year. But, I also hope that we can come back together.
We will have an annual conference in person this year as well. Would you like to mention a little bit about that?
Sure, absolutely. So the annual conference is going to be in May of this year, May the 1st through the 4th. And so, we also hope to see people join us there. It's going to be held in San Diego, California. And so now you can actually go onto the NWA website, and I think we still have our early bird registration available. So, feel free to get in there and register early so you can, benefit from those great rates. And there we have on the screen there the link where you can go in and sign up for our national annual conference. Again, it's going to be held in San Diego, California.
And that's really our town hall for WIC. That's really our major gathering of the WIC community. And it's available, I believe this year, it's available in a hybrid model. So if you want to go in person.
Yes, it's available in the hybrid model. So you can attend in person or you can attend virtually. And then just also a shameless plug too, that I'm working with the team to think through some really exciting panelists and speakers for the annual conference. And there may or may not be a party, a social gathering extravaganza that we're also planning that may or may not have a DJ. So there may or may not be some dancing, but really hope that folks join us for that. And then it'll be exciting for me too, to, really get to meet all of you in person if I have not already. So definitely, if you can join us for, the annual conference, May 1st through the 4th.
There's something else that happens annually in our organization, and it's a publication. I have to say, I think we're about to have the third. It is one of the most important resources I have been able to share with people who don't know much about our program. In a nutshell, it explains WIC, and it also talks about where we are in the journey from where we've been to where we need to go. It's the State of the WIC Report. What is this, and what is it about this year?
So the State of WIC Report this year is entitled, Building the Bridge to a Healthier Future, and it will be released actually, just before the National Policy Conference. So we're looking at around mid-February for publication. And so this, as Paul mentioned, this will be the third State of WIC Report, and it'll focus on the way forward for modernizing services to better serve families, increasing access through streamlining certifications, how we can innovate the WIC shopping experience. And from my experience in the travel that I've done so far in this role, that is a big topic of interest to our community. We'll also talk about in the report, growing and improving the WIC workforce. And I think another piece of that too is also diversifying that workforce. The report also will hit on the role of WIC in reducing hunger, improving child nutrition and health outcomes, as well as looking at racial and other systemic barriers to nutrition and infant feeding and the impacts of the Abbott formula recall, as well as reimagining the landscape of infant feeding. And then last but not least, the report will focus on the science of USDA, the food package rule, which we've talked a lot about today.
This is a report that I share with people who don't know anything about the program, as I mentioned, because really, if you want to know what WIC is and how it works, this report really encapsulates that in an amazing way. And in years past, I think probably this year too, it will have a state profile for every WIC program.
Yeah.
So if you want to understand what's going on in another state, you can find that profile in this report, and you can learn a lot about this program nationally.
Yeah, it really is a resource to, stakeholders. Not only we talked about how important it is for members of Congress to be hearing from representatives in their own states and localities, but, the State of WIC report will also be a good resource for them. It'll be a resource for our advocacy partners and allies in the field, for researchers, for folks thinking about the intersection of nutrition and health. So it's really going to be an important, I think, resource for many stakeholders in the field.
Dr. Taylor, one thing you mentioned that caught my ear was talking about the diversity of the WIC workforce. We face a lot of challenges in WIC. One is that, the requirements for being an RD are about to become a little harder. The requirements for becoming being part of the breastfeeding program are going to be increased in some ways. And it seems like every time we raise the bar, we leave people behind. Mm-hmm. What can we do to try to make sure our workforce reflects the people we serve?
Yeah, first I want to mention too that I think obviously it's important that, everyone working in these essential positions, are qualified and have the certifications that they need in order to, do their jobs in the best way that they can. At the same time, I think there has to be a recognition that when, there are such stringent requirements for some of these positions that it does push out, certain communities that are historically, underrepresented when it comes to these professions. And so the RD profession is one that we can talk about. Even in terms of lactation consultants and supports there, as well as a whole host of other positions that sort of work in or interface with the WIC program. And so I think as we, focus on diversifying the workforce, we also have to think about how structural barriers play a role in keeping certain communities and certain populations out of these workforces. And I think also to pay equity, can be a challenge when it comes to accessing these positions. And so, workforce diversity is a priority for NWA and how we're thinking about how to help advance that, in the WIC community. And, and that also means doing more outreach, to these populations, thinking through how are we working with HBCUs and other, minority serving institutions to help support efforts to ensure opportunity, for those populations that have been underrepresented. So it really is, I think, a multi-pronged approach that we need to consider when it comes to workforce diversity. But part of it is to, again, really taking stock of what those structural barriers are when it comes to even having access to the opportunities in the first place. And then making sure that we're sort of softening the ground, for folks of color to really advance and become a part of the WIC community, because it is important that they're there, because they do represent the participants and those families. And research also shows that across a whole host of, sort of support services, whether it's healthcare, social services supports, that it is important that families, particularly moms, it's important for them to see themselves and, the folks that they're working with that are part of these programs and services. It helps them receive the information better, and it also helps them have a better experience. And so we have to consider that when we're thinking about how to advance, diversity in the WIC workforce.
The things you're talking about feel to me like really planting seeds for the future. It's not going to happen quickly necessarily, but we need to do it knowing that it'll pay off down the road. Um, as we look at what you called out the 50th anniversary of WIC, which happens next year. What is your vision for the future of WIC after 50? What would you like to see this program become?
Yeah. You know, my vision is really, for there to be more of an intersectional focus in how we think about WIC and how we connect it with, sort of other essential supports that women and families need. As I mentioned earlier, a theme that has come from the conversations that I've had with moms and families participating in WIC is that their challenges don't end with, a lack of access to, nutritious foods. They are also talking to me about issues around having access to childcare or, pay equity issues or having support on their jobs, to continue on with their breastfeeding goals. And so, really thinking about, how we can be doing more to, strengthen, intersectionality really across all of these concerns. For me, I think a good place to start is when it comes to, healthcare and nutrition. And so, one of the themes that came out of the White House conference on hunger and nutrition was to, think about nutrition as medicine. And so for me, thinking about how NWA can play more of a role of, making those connections between healthcare, whether it's health policy, access to, healthcare services, health insurance through Medicaid and other publicly funded healthcare resources, connecting those to the WIC program and what WIC is doing and working on. And some of that is happening. There's an amazing program that I heard about in New Orleans when the NWA board was meeting there a couple of weeks ago. An amazing program at Crescent Family Services, a WIC clinic there that is linking, moms in the WIC program to doula care, which is absolutely amazing. I should preface this by saying that Crescent Family is also working with the Healthy Start Initiative to advance this model. But I've heard, rumblings through the WIC space about, what can we be doing to connect doulas, with moms that are participating in the WIC program or pregnant women that are participating in the WIC program. So that's huge because doulas, have a track record, and research shows that when a mom has access to a doula, she has better maternal health outcomes, her infants are healthier. And so really thinking about how NWA can play a role in helping to facilitate some of that integration or intersectionality that we're seeing or that we could be seeing across the program. I came into this role, as an advocate and leader in the maternal health space, particularly as an expert on, looking at the racial disparities in maternal and infant health. And I want to see that work built out more at the National WIC Association. I think it makes sense because of the relationship that, maternal health and infant health have to, being enrolled in WIC and access to quality nutrition. And so that is where I sort of see natural, sort of elevation of like the WIC and like where we need to go next. And then I think from there too, as we're thinking about doing the work in a more intersectional way, we can also be thinking strategically about the types of partnerships that we're having. Are we working with, BIPOC-led organizations that are, working to advance maternal health equity? How can NWA, how can WIC be a part of those conversations? So that's just one example of that.
You've had a long career in maternal and child health, and WIC has been on your radar, I know, for a long time. It sounds to me like you're bringing in your experience linking problems and solutions across organizations, across interest groups, to understand that it's all interconnected and that none of us can really do what we do alone, but we all have an interest in sort of the common the goal we all share, which is stronger and healthier and safer communities and families.
Yeah, absolutely. And I think it makes sense, right? I mean, women and their families, they don't lead single issue lives, as I mentioned. And so, um, you know, I have yet to talk to a mom that only is focusing on, one sole issue when it comes to the challenges that she's experienced in terms of the ability to raise her family, in safe environments, have access to affordable housing. Um, the ability to live free from racism, as well as a whole host of other issues. So for me, I'm constantly thinking about how we can be working across these silos. To be quite honest, how we can break down silos, which can be barriers when it comes to how we think about addressing these issues in a comprehensive way, in ways that make sense when it comes to what it means in the context of that woman's life or that family's life. And I just think it makes sense, right? And again, it's a part of how we think about innovation in WIC and how we move forward. With that in mind, coming up on the 50th anniversary, how can we be bolder, and do things differently when it comes to this program? And in doing that, we can help advance equity, in ways that we could have never imagined.
Thank you for all those wonderful thoughts. As I think about equity and WIC, one of the things that keeps coming to my mind is breastfeeding.
Mm-hmm.
And the reason is that we have disparate rates of breastfeeding in different communities in our country and different traditions that we need to honor and respect. And breastfeeding is not a simple thing for a lot of families. Even if they want to do it, it may not come easily. They need support. And they may not be able to do it with the pressure of work or, there could be a number of barriers in place. It's such an important part of what we do for families is supporting breastfeeding, and yet at the same time, there's so much emphasis in the WIC program on infant formula, which is important for many families, and even those who do breastfeed may supplement with formula. But it feels to me like formula gets a lot of attention and a lot of resources, and breastfeeding, no matter how important it is, maybe isn't quite in the same spotlight. What do you think we could do to support families that want to breastfeed, and to help them do it?
Yeah, well, I think I want to say that, the breastfeeding space, we talked about that issue around workforce diversity, right? And so I think that, one of the things that I have heard from women who have actually experienced this is that they've also experienced some challenges in, one, having access to, lactation consultants that can support them. I've largely heard this from women trying to navigate breastfeeding in hospital settings, which is pretty unfortunate. I actually spoke to a mother yesterday about, she was a white woman, but she shared with me how, after she had given birth to her child, she was sharing a room with another mom who, happened to be African American. And as a white mother, when she asked for support and had questions around breastfeeding, she was offered all of the support in a welcoming, nurturing way from staff in the hospital. But when the Black mother asked for support, she was shunned and told that, they needed to check her medical records to make sure, that she was healthy enough to breastfeed. And, she kept being put off. And so, I think that just goes back to the point about ensuring that, the workforce is adequately trained, to ensure that bias is not showing up in support for women and families who want to breastfeed. That's the first thing. And then also just making sure that all women have access to the education and other supports that they may need in order to, be able to reach their breastfeeding goals. And so I think the diversity piece is key. And then I also think too, like thinking creatively about how we're working with those on the front lines that are really meeting families where they are. And so that includes WIC staff, for example. WIC staff are often the first responders when it comes to families and their efforts to, reach their breastfeeding goals. And so I think working across the WIC community, who has always done a great job in ensuring that families have that support, is key. But also, how are we also connecting with community-based organizations, for example, who may also be WIC sites, and making sure they have the resources that they need to support moms and families. But I think the key is to, if a mom comes to you and she has goals to breastfeed and doesn't know where to start or doesn't know, is getting tripped up, in continuing her breastfeeding journey for a whole host of reasons. The key is that she is supported and that she has access to the relevant information and tools that she needs to be successful. And if not, if for some reason, she's not able to continue on with those goals, we should never stigmatize her or her family if they choose to supplement or they decide to transition into formula. And so I think that's another piece too. I think sometimes, we can almost, we have to be careful not to shame moms who may not be able to breastfeed for a whole host of reasons. And we should support them.
Thank you. I think that's a really balanced view. It certainly is a wonderful way to feed an infant, and it isn't the only way, and it doesn't work for everybody. And for those who want to do it, we should do everything we can to be supportive of them. And it's encouraging that some things like, for example, the Pump for Nursing Mothers Act, which passed as part of the Omnibus spending bill at the end of last year,
Right.
gives the right to break time and a space to pump breast milk at work for millions of workers, including teachers and nurses, and lets them actually file a lawsuit to seek remedies, monetary damages in the event that their employer doesn't comply. So that was progress.
Yes, it was progress and such something to celebrate for the community. And I will say too that, whereas the Pump Act, would support millions of workers, there's still going to be workers that are left out of the equation there. And so, many mothers working in low wage jobs, for example, typically don't have the support to breastfeed when they go back to work. So again, I think that's just also something, for those that are working, in the lactation space, to be mindful of, as you're working with moms to help them try to figure out what the best, feeding course of action is for their children, having to return to work and the stress that can be associated with that. If that support is not there, depending on the type of job you have, that can be a real challenge. So it's not available to every mom, unfortunately, and we need to move forward to a place that it is available to every woman and every working any job, no matter what.
Yeah. And I think the Pump Act also shows the power of the National WIC Association, because
Yes.
our staff helped get that over the line.
Absolutely. Absolutely. And there were some other good things in the Omnibus Bill too. The Pregnant Workers Fairness Act was also something that we had a hand in helping to advance there. And there was also, more funding going to support maternal health across the board, under the Medicaid program, extending postpartum Medicaid coverage up to 1 year, as well as additional resources for the WIC program. And so the Omnibus had a lot of good things in there, and we did think that it could go further in some ways, but I think there were some good things there, and that we have a lot to be celebrating in this new year, and hopefully we'll continue to be able to advance, some of these important innovations for, WIC families as well.
Dr. Taylor, I'd love to know what you would like the community to know, and also want to just mention that I deeply appreciate your commitment and passion for equity and diversity in this work. And as somebody who's running a state program, I know that has to be a fire that stays lighted. It doesn't happen by itself, and it is hard work. and it requires honesty and courage. So thank you for helping lead us to a more just community and a more just world. What would you like the National WIC Association membership and the larger community to know?
I want the membership to know that, I know I haven't been able to meet everyone just yet, and I'm hoping to meet all of you, by the end of the year at least. We're going to be coming together, for the annual conference in person, and there'll be a virtual option there too, as well as a whole host of other opportunities to connect. And I think also to let you all know that my door is always open. I'm available and happy to hold meetings with you all, whether it's virtually. I'm happy to come visit if you have an invitation for me. I have really found such pleasure in, learning more about the WIC program. And I think the thing that's been most valuable for me is actually being on the ground, meeting members, meeting participants. And I'm happy to do that. And I am also bringing those stories and what I hear to folks at USDA, to members of Congress, and other key stakeholders. I'm proud to bring those messages in any room that I enter. And so feel free, to set up time to meet with me. I'd be happy to. And then we should also mention, Paul, that you and I actually have virtual office hours taking place on the third Thursday of each month. And so if for some reason, I can't come and visit you all in person, or we can't schedule a separate meeting, please join these virtual office hours that Paul and I are hosting. They are a great opportunity to get FaceTime with me as well as Paul, and then for us to talk through in more detail some of the issues that we've talked about today, or even other things that you want to help unpack or just brainstorm with us about. We love these office hours, so we'd love to see more people there too.
It's one of the ways I think we learn best about the membership and about what they're experiencing is the chance to just have an informal conversation at our office hours with the people who come. And last time we had several people come from Indian tribal organizations or organizations that represent tribes that are connected to WIC. And we had a really great conversation about the priorities of our Native and Indigenous and Alaska Native families around the food selection, around how the service works differently in small organizations and tribal organizations. It was really rich, fascinating, and helpful to have that conversation. And I really treasure those chances to talk directly to our WIC community.
Absolutely. And also too, I'll plug this by saying if there are things that you sort of don't hear from us, whether it's through our webinars that we're hosting, our Friday meetings. I know we have our state directors meetings as well as our WIC Action Network meetings, or any other sort of settings or events that we're facilitating. If there are issues that don't come up for you and that you feel like we should be hitting on in these meetings, please feel free to reach out and let us know. Like, we want to be responsive to the membership and what's forefront in your minds when it comes to how we're helping to serve you. That's why we're here.
Thank you, Dr. Taylor. It's been a real pleasure to speak with you today. Do you have any final words you'd like to share with everybody?
Just want to thank everyone. As I mentioned earlier in the program, everyone in this community, who has reached out to me so far, everyone has been so welcoming, and I continue to get cards and emails and cookbooks with yummy vegetable recipes. And it's just been a delight. And and I am so happy to be a part of this community. I'm still learning so much, but at the same time, in 2 short months, I've learned so much. And I'm just excited to continue on this journey with you all. And we're cooking up a lot of exciting things, and I hope you'll join us and be a part of it.
Thank you so much, Dr. Taylor. Welcome to the National WIC Association.
Thank you. Okay, we're done.